Thank you for attending the number 2 installment of AOR's webinar series 2012. Today we'll be taking a look at cardiovascular disease and the different subsets of diseases that make up cardiovascular disease. We'll also take a look at the known risk factors, from lifestyle risk factors to health risk factors, and what you can do to modify these risk factors and help prevent and aid cardiovascular disease.
So what is the cardiovascular system? The cardiovascular system includes the heart and the blood vessels. The main functions of the cardiovascular system is to deliver oxygen and nutrients to the surrounding tissues and to also remove the byproducts of metabolism such as carbon dioxide and waste products. So one of the most important parts of the cardiovascular system is our heart. It's the most efficient muscle we have in our body. During the human lifetime, it beats about 2.5 billion beats in the lifetime. Every day, it beats about 100,000 beats per day. And also every day, it pumps about 7,200 liters of blood, which is pretty significant. So right here, we have a diagram kind of the circulatory system, which makes up the arteries and the veins. And what you want to focus on here is right here, from the heart. This is after the heart has pumped the blood through the arteries. The blood then goes through the arteries into smaller venules such as the arterioles to the capillaries. Then what happens is oxygen and nutrients are delivered from these capillaries into the surrounding tissue. Waste products from this tissue are then put back into the capillaries, and then they're transported back to the heart through the venules and the veins. One of the things that you want to notice between the difference between the arteries and the veins is something called the tunica media, or the middle layer here in the arteries versus the middle layer here in the veins. And why this is significant is because if you look at this muscle layer in the middle of the arteries, it's a lot bigger than that over here in the veins. And the reason why that's significant is because the arteries have a harder job and a bigger job to be able to actually pump blood from the heart out to the rest of the system, fighting gravity, but also having to basically push it through the system. So cardiovascular disease and the diseases that make this up is diseases that affect the heart and the blood vessels. It's the number 2 leading cause of death in Canada behind cancer. And this is a very recent change. Cancer used to be number 2, but overtook cardiovascular disease in the last few years. Cardiovascular diseases account for about 22% of all deaths in 2010, and 1 death every 7 minutes, and accounts for 1 heart attack every 7 minutes as well. So the stats. How does cardiovascular disease affect our economics as a country? The cost of the Canadian economy from cardiovascular disease is more than $22 billion every year. Cardiovascular diseases, the ones that make them up, is the leading causes of hospitalizations in Canada, accounting for almost 17% of all total hospitalizations. Us as Canadians, 90% of us have at least one risk factor for developing heart disease or stroke, and we'll talk a little bit about those risk factors in a bit. So the 6 major types that make up cardiovascular disease, we have ischemic heart disease, and this is basically a heart attack or a myocardial infarction, as it's also known, and it's often associated with angina pain. Cerebrovascular disease, also known as a stroke, affects the brain. Peripheral vascular diseases, and this is diseases that occur outside the brain, outside the heart, and this is usually due to a narrowing of vessels that carry blood to the legs, arms, stomach, and kidneys. Heart failure, it's a condition that results from structural or functional defects in the heart itself, and it causes the heart an inability to actually fill with blood or to be able to pump blood throughout our system. Rheumatic heart disease is a condition where heart valves are damaged, and this is due to rheumatic fever, and then congenital heart disease, diseases which are conditions that occur in the womb. Ischemic heart disease is the most common type of cardiovascular disease. It's caused from blocked arteries that reduce blood flow to the heart, and this results in a heart attack. And I'm just going to answer this kind of question because I usually get this question a lot. People hear arterial sclerosis and atherosclerosis, kind of what's the difference. And arterial sclerosis is known as a hardening of the arteries, and usually what this is a hardening that occurs as calcium deposits. If it affects the heart, if it affects the vessels that supply blood to the heart, it's known as coronary artery disease. Atherosclerosis is another type of hardening of the arteries, but it usually occurs with lipids, in particular cholesterol, that build up on the side of the arterial walls. Cerebrovascular disease results due to blocked arteries that reduce blood flow to the brain, and this can result in a stroke. Peripheral vascular disease, also known as peripheral artery disease, is a reduction in circulation, usually in the legs, and this again, like the other two, is caused by a blockage in these vessels, or can be caused by clots in these vessels. The main symptom that people experience due to this is leg pain. This leg pain can also be felt as a dull cramping pain. It can also be found as heaviness, tightness, or tiredness in the muscles of the legs. And how this contributes to coronary artery disease or cardiovascular disease of the heart is having large vessel peripheral artery disease increases mortality or death from cardiovascular disease significantly. Those who have peripheral artery disease have a greater than 20% risk of having a coronary or a myocardial infarction within 10 years. So greater than 20% risk of developing a heart attack in 10 years for those who have peripheral artery disease. Heart failure. Heart failure results from damage to the heart, and this damage can occur from someone who's had a heart attack or has a disease that actually affects the tissue or the muscle of the heart. And the consequences of heart failure is an inability or a decreased ability to be able to supply adequate blood and oxygen to the body, because the heart isn't able to actually pump that blood effectively out to the rest of the body. I grouped these together because we're not really going to cover too much of these. They're not really something that we see later in life, more in very early stages in life, and they're very difficult to prevent. Rheumatic and congenital heart disease can occur in childhood due to bacterial infections or a birth defect, and this results in a damage to the heart valves, or the little valves, leaflets inside our heart, or the actual structure itself. One of the ways to try to prevent this is aggressive treatment of strep throat with antibiotics, and also treating rheumatic fever should it occur. So risk factors for developing cardiovascular disease. And these are very interesting because there's two sets. There's lifestyle risk factors and there's health risk factors. And we'll go into a little bit how they kind of interplay in a few slides. But the lifestyle risk factors include smoking, physical inactivity, unhealthy diet, and stress. And these are factors that we have the ability to be able to kind of modify through our lifestyle. And if you notice there at the bottom, there's kind of a ... and flossing. And the reason why I put this in is because flossing isn't actually considered a lifestyle factor. But the interesting thing is when you actually look at some of the statistics on flossing and some of the studies, they've shown that those who floss regularly, 5 to 7 times a week, are 50% less likely to develop or less likely to have a heart attack. And this isn't necessarily attributed just to the flossing. One of the reasons why this is because they've attributed that those who floss on a regular basis are also more likely to be able to modify these lifestyle factors and have healthy lifestyle factors. So those who take care of their gums, take care of their teeth, are more likely to eat healthier, be physically active, don't smoke, and be able to better manage their stress. The actual link between gums and teeth and heart disease is those who have, they've done some research and they've shown that those who have periodontal disease, or which is a disease of the tissue that surrounds or supports the teeth, those who have that have a 1.14 times higher risk of developing cardiovascular disease than those who do not. And an interesting thing is there was some researchers who found that they took a population of about 650 people, and they found that those who had higher blood levels of certain disease-causing bacteria in their mouth were more likely to have atherosclerosis in the carotid artery in the neck. So those who had more bacteria, that disease-causing bacteria in their mouth, had more atherosclerosis in the carotid artery than those who did not have these bacteria in the neck. or as much of the bacteria in the mouth. Health factors that affect cardiovascular disease, having high cholesterol, having high blood pressure, and having diabetes type 2. So the interlink between these risk factors is lifestyle risk factors are often linked to the risk factors, to the health risk factors. Lifestyle factors, so we're not having proper lifestyle factors, not exercising regularly, not eating a good diet, smoking, having high amounts of stress lead to health problems, such as the health risk factors like diabetes, having high blood pressure, having high cholesterol, and then in turn can lead to cardiovascular disease. The lifestyle factors, we're going to go into a little more in depth about these. These factors are modifiable with lifestyle changes. So these are factors that we can actually change right now. Smoking. Smoking reduces the oxygen level in the blood. They've also shown that people after having a cigarette, there's a dramatic increase in their heart rate. Can also immediately increases blood pressure and contributes to arterial plaque formation. And how this does is because it increases the oxidation of cholesterol inside of our system, and then that can in turn create plaques and help damage the vessels in our circulatory system. Smoking also decreases HDL, which is, we'll go a little bit into it later, which is our good cholesterol, and also increases LDL, which is our bad cholesterol. Smoking actually doubles the risk of developing a stroke, and smoking, there's a greater than 70% chance of dying from heart disease with those who smoke and those who don't. It was estimated that 40 to 45% of heart disease in people under the age of 65, smoking can be a significantly contributing factor to that. The good news is, though, that quitting smoking reduces the risk of cardiovascular disease by 50% in just 1 year. And after 5 years of stopping smoking, that risk of developing cardiovascular disease goes back to normal. So I'm very interested in statistics. So let's go into some of the smoking rates here in Canada. This is the last one that I could find. This is of 2008. If we actually look at smoking rates here in Canada, the wonderful people on the West Coast here in BC actually have the least amount of smokers in 2008. And if you actually look at the highest, it's here in Manitoba at 21%. Interesting thing as well is if you actually look at smoking rates, the highest rise in percentage of smokers is actually in girls 18 to 24 years old. And another interesting statistic is in about 1965, where they first kept smoking rates, it was estimated about 50% of the population smoked. So physical inactivity. Regular exercise keeps the heart healthy. That's something I think we all understand. Interestingly enough, 50% of Canadians report being inactive. And we actually break this down by province. The least active province is Nunavut at 41%, and the most active province is actually British Columbia at 58%. So low smoking rates and highest physical activity rates. And Ontario falls about 52% of people report being physically inactive. Inactivity actually doubles the risk of developing heart disease. And as we know, exercise also reduces other cardiovascular risk factors, such as the health risk factors, such as diabetes, blood pressure, and cholesterol. Exercise is able to help reduce cholesterol, reduce blood pressure, and reduce our risk of developing diabetes and actually help in diabetes. So having an unhealthy diet. So what's considered an unhealthy diet? Very basically, a diet high in salt, high in saturated fat, high in cholesterol, high in refined sugar, and low in nutrient density, so vitamins and minerals and natural antioxidants that are found in food, and low in fiber. Here's a graph showing the percentage of Americans with inadequate intakes from food based on the estimated average requirements. So I want you to pay attention to the top two here because these are the two most important ones, vitamin E and magnesium, because we'll talk a little bit about those later, and we actually look at the rates of percentage of Americans with inadequate intakes, we're looking at 93 and 56, so head and shoulders above the rest. So salt. Prior to the invention of refined salt, our average intake was about 768 milligrams per day, and the standard North American diet today consumes about 4,000 milligrams of salt. That's about 5 times more than before the invention of refined salt. 90% of salt in the U.S. diet is added, not naturally sourced, it's added. And excessive sodium intake in diet is linked to high blood pressure and an increased risk of developing cardiovascular disease. Interestingly enough, they've done some studies in Africa with people who migrate from rural areas to urban areas. And then one of the things that they've monitored is salt intake, and they've shown that excessive consumption of sodium can lead to a significant rise in systolic blood pressure, mean blood pressure, and also diastolic blood pressure. But the interesting thing is the change can be completely reversed in 6 months after the cessation of excessive salt from our diet. So fat. And the key with fat is getting the right kind of fat. Diets high in cholesterol, saturated fats, trans fats are linked to an increased risk of developing heart disease. And what we really want to look at is fats such as polyunsaturated fats, which help reduce the risk. In clinical studies, they've shown that trans fatty acids or hydrogenated fats tend to raise total blood cholesterol levels. They also raise total cholesterol more than saturated fats, so that's trans fats and hydrogenated fats increase total cholesterol more than saturated fats. And trans fats also tend to raise LDL, which is our bad cholesterol, and lower HDL, which is our good cholesterol. When people use when they use this instead of cis fatty acids or natural oils. And these changes can increase the risk of developing heart disease. Sugar. One of the problems with sugar-based foods is they're usually very low in nutrient density and have empty calories. High in sugar, not high in vitamins and minerals. And consuming excess of sugar contributes to obesity, which can increase our risk of developing diabetes, can increase our risk of high blood pressure, increase our risk of cholesterol, which are all health risk factors. And the interesting thing is they did something in the nurses' health study. They showed that women who consume diets with a high glycemic load, so what high glycemic load is basically a measurement of the foods that we eat and what the effect that has upon insulin levels and the insulin spike in our body. They've shown that those who have a high glycemic loads in their diet have an increased risk of cardiovascular disease, and those who fall in the highest diets with highest glycemic loads have an over 2-fold increase in developing cardiovascular disease during 10 years. Another lifestyle risk factor is stress. And stress levels can increase blood pressure just due to hormone fluctuations that happen during stress and increase the risk of developing heart disease and stroke. So one of the reasons why stress can be such a havoc upon our body and increase the risk of heart disease is when we're under duty to stress due to persistent elevated levels of hormones like adrenaline and cortisol, blood pressure goes up. The way we tend to cope with that possibly is overeating. When we tend to overeat, when we're stressed, we don't tend to eat nutrient-dense foods. We choose to eat nutrient-undense foods. Also, another way we cope with stress is we may not exercise nearly as much. We may cease exercise. And also, during times of stress, people are more likely to smoke. So all of our health risks or our lifestyle risk factors actually become heightened during elevated and chronic stress. Another interesting thing with stress and how it affects our circulatory system is they've shown that stress actually changes, long-term chronic stress actually changes the way our blood clots, which can increase the risk of developing a heart attack. I'm a numbers person, so one of the interesting things with stress is they've shown that the annual cost to Canada of work time loss due to stress is about $12 billion a year. And on average, the average corporation loses about 16 days in productivity per worker due to stress, anxiety, and depression. So some of the ways to positively cope with stress, which is a lifestyle factor for heart disease, is exercise. And very interesting, a study in 2001 by Duke University in North Carolina found that exercise is more effective treatment for depression than antidepressants, with fewer relapses and a higher recovery rate. An earlier study done by the same university found that patients who completed 30 minutes of brisk exercise at least 3 times a week had a significantly lower incidence of relapse. Only about 8% of the patients in the exercise group had their depression return, while 38% of the drug-only group had their depression return. Some of the other, just like I mentioned before, the harmful ways to cope with stress is alcohol use, tobacco use, and unhealthy foods. The health factors, these are usually linked to lifestyle factors and are modifiable through changing our lifestyle. High cholesterol. So when we look at cholesterol, we have to look at the different parts of it. And when we look at the different parts, we find there's something called LDL cholesterol, which is known as the bad cholesterol. And this contributes to atherosclerosis. And we have HDL cholesterol, which is also known as the good cholesterol. And having low HDL increases our risk of developing heart attack and stroke. One of the things why LDL can become a problematic type of cholesterol is because it becomes oxidized. And when it becomes oxidized, it can contribute to atherosclerosis and damaging of the arteries. Research has shown that 44% of individuals who had average LDL cholesterol greater than 160 had calcification in their arteries, while those who had LDL levels lower than 70, only 8% had calcification of the arteries. So they've basically shown that there's a link between having high cholesterol and more calcification in the arteries and having lower levels of LDL, lower level calcification in the arteries. So I'm going to bring up a point here of cholesterol and how effective is it actually in predicting heart disease. And we actually have something that's better at predicting heart disease than cholesterol. And I'm going to bring up some evidence here in terms of inflammation, and something called C-reactive protein may actually be a better marker than cholesterol for determining heart disease risk. So they've shown that there's been a link between elevated CRP, which is C-reactive protein, it's a marker of inflammation, and heart disease. It's been demonstrated repeatedly. Some evidence has shown that CRP may be a more important indicator of heart disease than high LDL. And one of the big bodies of evidence is an 8-year study involving almost 28,000 women, and they showed that more than half of these women who eventually developed heart disease had high CRP, even though their LDL cholesterols were not considered high. Kind of just some food for thought there about when we're looking at heart disease, maybe we will also be looking at inflammation, not just focusing on the known identifiable health factors such as high blood pressure, diabetes, and cholesterol. We may also want to look at inflammation. Dr. Ricker, who works at something called the Cleveland Clinic, he also estimates that this last little study here, this may also be true for about 25% of the U.S. population. So about 25% of the U.S. population will probably develop heart disease, will have high CRP, but actually have not high levels of LDL. An interesting thing he also did as well is he took about 500 patients and he did ultrasound, and he found that clogged coronary arteries had not gotten worse amongst these patients who were most successful at reducing their CRP levels. So he, instead of reducing cholesterol, he used reduced inflammation and CRP, and he found that those who were better able to get their CRP did not have any further clogging of the coronary arteries. So atherosclerosis. It's buildup of plaque, kind of mentioned this previously, so those very quickly. Buildup of plaque in the arteries, and why is this significant? Because it leads to a reduced blood flow and blockage in his arteries, so it makes the vessels more narrow. And why this is significant? Because a clot can form inside these narrow vessels. Clot can rupture, can lead to a breakup of that or an emboli, and an emboli can lead to a heart attack, stroke, or a pulmonary emboli inside the lung. High blood pressure. Blood pressure, to be considered high, we have to get a reading of 140 systolic over 90 diastolic, and this has to be on 3 different occasions. It's estimated over 4 million people in Canada have high blood pressure. That's about 20% of the population. Many are unaware that they even have it, which is even more astounding because even though there's a significant percent of the population who have high blood pressure, many people with high blood pressure don't even know that they have it. And high blood pressure, why it's significant? Because it can lead to damaging of the blood vessels and can lead to atherosclerosis. Having higher pressure going through our arteries, our blood vessels have to deal with this high blood pressure, can damage the size of these vessels. Once these sides of our vessels get damaged, we have to patch them up, can lead to clotting and atherosclerosis. Interesting, when we actually look at blood pressure rates, according to the Heart and Stroke Foundation, between 1994 and 2005, the occurrences of those diagnosed with high blood pressure rose 77% during that 11-year span. The biggest spike in that span was Canadians aged 35 to 49, and those provinces leading the way in terms of growth of numbers of high blood pressure. Yukon number 1, Northwest Territories number 2, and Nunavut number 3. And actually the least increase in blood pressure of a province we've seen is in Manitoba, which is interesting, highest smoking rates, but lowest increase in blood pressure. Diabetes, another health risk factor. So it's reported about 1 in 16 Canadians have diabetes. And diabetes can increase the risk of people developing hypertension or high blood pressure, increase the risk of coronary artery disease and stroke. And how this happens is excess sugar flowing around in the bloodstream can damage the blood vessels, and then we get a thickening of these vessels. And when we get a thickening of these vessels, it makes these vessels less elastic and less pliable, and less be able to actually cope with blood flowing through them, and there's more resistance that occurs due to this less elasticity. And diabetes, as we're very familiar with, is especially dangerous if it's very poorly controlled. By U.S. projections, in about 2030, it's going to be reported 50% of Americans will be clinically obese. And that's not overweight, that's obese. So steps we can take to protect our heart. In North America, the greatest threat to heart health is diet and lifestyle choices. In most cases, chronic diseases are preventable. Your health is up to you. So by eating fresh, unprocessed foods, exercising regularly, keeping stress in check, and supplementing your diet can help protect your heart. So we're going to look at some nutrients that are beneficial for the heart, be able to reduce cholesterol, reduce inflammation, reduce blood pressure, and help with conditions such as congestive heart failure. Magnesium. Magnesium is an essential mineral for heart health and the function of our heart. It helps contribute to a decrease in the resistance found in our vessels, helps lower blood pressure, and helps to reduce our heart rate. If we go back to that inadequacy chart for diets, we showed that about 56% of Americans were deficient in magnesium through the diet. And it's important because it's involved in over about 300 different biochemical reactions, and deficiencies can be linked to many cardiovascular disease risk factors. So when looking at magnesium, choosing the right kind is what's important. Two types you want to look at for heart health specifically is one called magnesium orotate, which provides orotic acid. And orotic acid is able to improve cardiac function through things such as increasing the supply of cardiac glycogen or sugar we have available to our heart cells, increasing protein synthesis in our heart, increasing ATP or energy levels in our heart. And this is important because those who have had a heart attack or have heart failure have significantly depressed levels of ATP inside their cells in their heart. A study of about 32 people with congestive heart failure over 8 weeks using magnesium orotate, they found that those who supplemented with it had an increase in heart functions such as exercise time, angina-free walking distance. This is very important when looking at people with congestive heart failure. A good marker is actually looking at how far they can walk without getting that chest pain. Magnesium orotate is also able to increase VO2 max, and they also noticed that those who were able to use magnesium orotate had a 63% lower risk of suffering extrasystole, or an extra kind of heartbeat that happens, which can be common after those who have developed heart failure. Another type you want to look at is magnesium taurate, and magnesium taurate provides the amino acid called taurine, which is able to help regulate our heartbeat. And this is important for people who have congestive heart failure, as we talked about with stabilizing the heart rate and the extra systole that occurs. Taurine is able to do this as well, and it's able to act as a cardioprotective to our heart. So when looking at magnesium, we want to know how much to take, A good dose to look at is about 300 milligrams a day. People always are very concerned about the bowel side effects. 300 milligrams should be a very safe dose for not getting any sort of adverse effects in our bowels. For that, you're probably looking at 600 milligrams plus a day. And when to take? Anytime. Magnesium is good any time of the day. CoQ10 as another thing for our heart. It's an effective adjunct or co-treatment for people with heart failure. We'll talk about some of the outcomes in some further slides. It's able to improve the overall function of our heart. And how it's able to do this is able to increase ATP production in the electron transport chain, which is found right here in the middle of our mitochondria. It helps with energy production for every cell in our body. It improves performance in athletes. And they've also used it in patients who have, in the elderly patients who have had surgery and measuring outcomes of their heart after surgery. And they've shown that it's able to increase their heart functions after having surgery on their heart. Clinical trials involving about 2,600 individuals showed improvement in many of these heart functions, such as heart rate, blood pressure, arrhythmia, and able to actually reduce cholesterol as well. Just as we talked about before, for the mitochondria right here, it's able to help with cellular energy production, able to protect the heart, prevents LDL oxidation, so able to help with cholesterol, and stabilizes platelet cell membranes, so the little cells that can float around in our blood that are trying to clot. In terms of a dose for it, the dose to start usually around is anywhere between 100 to 200 milligrams per day, or depending on body size, you can look at about 2 milligrams per kilogram of body weight. So a study here comparing CoQ10 to a placebo, they found that after treatment, this is after about 28 days after people who had a heart attack, they found there's a significant decrease in angina or chest pain, significant decrease in total arrhythmias, significant increase in the function of our left ventricle, which is the last chamber of our heart that pumps blood into our aorta that then sends it out to the rest of our system. They also found a significant decrease in total cardiac events or heart attacks, and this includes a decrease in deaths from heart attacks, but also a decrease in infarctions that didn't result in death. Vitamin E, getting the right type of vitamin E is extremely important. If we look back at that inadequacy chart again, vitamin E was the #1 vitamin mineral found on that chart, and getting the right is what's important. Vitamin E is not a single molecule. It's actually made up of a complex of tocopherols and tocotrienols. And we actually look at the ratio of these in people with heart failure. Usually there's a high balance of alpha to gamma tocopherol in these patients. And why this is significant is because when we're actually looking at heart function, gamma tocopherol is actually the most important of the tocopherols for heart function. And there's actually problems with alpha tocopherol, high alpha tocopherol supplementation in people with heart conditions. They've shown that after 1 month of people supplementing about 400 IUs of alpha tocopherol, people's gamma tocopherol, the one important for heart health, is significantly reduced by 2/3. And it may take as much as 2 years for this ratio of alpha to gamma to normalize after an unbalanced alpha tocopherol supplementation is even stopped. So 2 years of work to fix it after 1 month of just supplementation. The other part of the complex is something called tocotrienols. And tocotrienols are significant because research they've done has shown they're able to lower cholesterol levels by about 31% in 4 weeks. And this reduction accounts for about a 22% reduction in total cholesterol and a 10 to 20% reduction in just LDL cholesterol. And one of the very interesting mechanisms of tocotrienols is they work similarly but slightly different to a class of cholesterol-lowering drugs known as statins. Statin drugs work by blocking something called HMG-CoA's reductase, the receptor site. And what tocotrienols do is actually increase the degradation of the HM-CoA reductase enzyme, which therefore makes it devoid of the statin-like drug side effects, most notably myopathy, depletion of CoQ10 levels, and particularly inside the heart tissue. So similar mechanism, not as significant for symptoms or side effects for it. Gamma tocopherol, one of the reasons why it's very important for the actual heart itself is because it's able to regulate fluid pressure around cells. And having high fluid pressure around these cells can actually lead to hypertension, high blood pressure. Fish oils, not going to go too much in depth with these because it's a big topic. Fish oils, very briefly, good for your heart. Study they did showing treatment of just 1 gram of omega-3 fatty acids per day reduced the amount of deaths from deaths overall, reduced cardiovascular death by 30% and sudden cardiac death. So people who have a heart attack and die immediately from that by about 45%. Hawthorn. Hawthorn is a berry. You can see a picture of it here on the side over here. And why it's significant for heart health? It contains things, beneficial flavonoids. And it's very effective for being able to help a damaged heart. And a damaged heart, we have to look at stuff like ischemic heart disease and also people with congestive heart disease. They've also shown that it's able to reduce cholesterol and increase HDL levels at about 600 milligrams per day. So people with the damaged heart and how it's effective, there's a study here about 1,000 people, and this lasted about 6 months of study. They've shown that it's able to reduce blood pressure and reduce heart rate. It's also be able to increase exercise performance of people with heart failure. And it's a very important marker for people with heart failure is to be able to measure their ability to exercise with heart failure. So it was able to actually improve the people with heart failure, their ability and the amount of time they're able to exercise. Able to improve the function of a heart, more importantly, the ejection fraction or that left ventricle, how much that ventricle can actually push and pump blood out into our aorta. So it's able to increase the ejection fraction and actually able to reduce other common symptoms that are associated with heart failure, such as nocturia or urination during the middle of the night, and shin edema, so swelling inside shins, which are common symptoms, concomitant symptoms of heart failure. They also showed with Hawthorn that it was able to help with angina or that chest pain that occurs, reduce the blockage in the heart. There was a study only using 180 milligrams of Hawthorn or a placebo for 3 weeks, and they found that those who were using Hawthorn had an improved blood flow to the heart and were also able to exercise for longer periods of time without suffering chest pain. There's an interesting study here looking, comparing Hawthorn at 900 milligrams a day for 2 months compared to something called captopril, which is it's an ACE inhibitor blood pressure drug. And they found that it was as effective as captopril in improving symptoms of heart failure. Niacin, known as B3, large human trial in about 8,300 people who had already suffered a heart attack, divided them up into people to get 4 different groups for cholesterol drugs, niacin or a placebo pill. Niacin therapy cut the rate of non-fatal, so heart attacks that didn't result in death, by 27%, reduced the amount of strokes by 26% over the course of the trial. And they found that the men taking niacin supplements were 11% less likely to die from any cause compared to the placebo group. Another trial involving niacin, comparing it to lovastatin or a statin or a cholesterol-lowering drug, showed that niacin lowered LDL not as effective as the statin, but just as close. 32% reduction for the statin, 23% for the niacin. But the interesting thing is, niacin was able to elevate HDL, the good cholesterol, by 33%, while the statin was only able to increase it by 6%. Another outstanding thing about it as well is niacin lowered something called lipoprotein A, or LPA, by 35%, while lovastatin had no effect upon lowering LPA. And why this is significant is because LPA is it's a risk factor for developing atherosclerotic diseases, and then as we've previously mentioned, atherosclerosis can lead to things like coronary heart disease and stroke. Niacin was able to reduce this, lovastatin did not. Terminala Arjuna, clinical trials have shown benefit for congestive heart failure, increasing cardiac muscle capacity, so the capacity of these cells to be able to pump blood. And that's on the next little point here. Increase the blood pumping activity of the heart by 10%, and the ability to empty the left ventricle by 20. So basically what the emptying of the left ventricle is a measurement of how much blood was left in the ventricle after it's pumped blood out. The less blood in there, the more efficient it was able to pump blood out into the system. Terminal was also able to reduce angina attacks by 2/3 in people with something called stable angina. In a recent open trial, so an open trial they did in about 20 patients with those who were taking stable angina, with stable angina, were taking Arjuna or something called arsosorbide mononitrate, which is an angina drug that works very similar to nitroglycerin for 12 weeks. They found that Arjuna was found to work as well as the drug, but with fewer side effects or signs of toxicity. It alleviated symptoms of 80% of the angina patients, which is comparable to 70% of the patients which were relieved by the drug. The drug was, however, 6% better in being able to reduce the frequency of angina attacks by 73%, while Arjuna 67%. So things that are able to help reduce cholesterol and act as a cardioprotective. So we're going to look at cholesterol and also inflammation very briefly here, because we talked a little bit about inflammation and how it reduces the risk in cholesterol. So curcumin, interesting thing with curcumin is able to reduce CRP, so it's actually able to reduce that inflammation. And there's actually a study that showed that it was able to increase HDL, or good cholesterol, by 29 and lower total cholesterol by 11%. Polyphenols, another thing significant for reducing risk factors for cholesterol, helps prevent the oxidation of LDL. But interesting thing is it reduces something called apolipoprotein B, and apolipoprotein B. They've done some studies, and they're saying that it's actually a better indicator of heart disease risk than total cholesterol. So it's kind of on that same level as inflammation as being a better risk factor for heart disease than total cholesterol. Hydroxytyrosol, which is an active ingredient found in olive oil, studies have shown it's able to reduce the oxidation of LDL, so contribute to that plaque, and it's able to reduce blood pressure. You can find these ingredients in a product called Advanced Cardiac Support from AOR, which is a product that's used to help reduce cholesterol and support cardiac function. So if we're looking just specifically at reducing cholesterol, a few key ingredients. One is berberine. Berberine has been shown to reduce total cholesterol by about 18%, reduce LDL by about 21%. And how it's able to do this is it upregulates something called the LDL receptors, which causes more LDL cholesterol to be taken up by the cells, removing it from the blood. Artichoke leaf, another effective reducer in total cholesterol. I see a spelling mistake there. Apologize for that. 18.5% reduction in total cholesterol, 22.9% reduction in LDL. And how artichoke works is enhances the production of bile from our liver and the flow of bile from our gallbladder. Since bile is very high in cholesterol, this increased flow and production of bile helps to eliminate cholesterol through our body through something called enterohepatic recirculation, and then the end point is it's sent out through our bowels. Another key ingredient is theoflavin, which is found in green and black teas. It's able to reduce total cholesterol by 11%, LDL by 16%, and what this is able to do is for plaque formation is it's able to prevent the oxidation of LDL and contribute to a decreased risk of developing plaque formation in our arteries. Plant sterols lowers cholesterol, LDL, by 15%, and this is in conjunction with a healthy diet, the research has shown. And how this works is plant sterols have a very similar chemical structure to cholesterol. They do not increase cholesterol level in humans, but they compete with cholesterol absorption in our intestines into our bloodstream since they're a very similar chemical structure. And this competition for absorption means less cholesterol can get absorbed into our blood, which has an overall lowering effect of cholesterol. We're going to talk about a concept here, and the concept is nitric oxide and how this affects different facets of cardiovascular health and function. They've shown that there can be a dramatic reduction in blood pressure following ingestion of dark leafy vegetables like beetroot, spinach, and lettuce, which are high in something called nitrate. And how this is significant in terms of biochemistry is nitrates along a path get converted to something called nitric oxide. And nitric oxide is a vasodilator of our circulatory system, being able to reduce blood pressure by dilating the size of these vessels. The larger vessels, less resistance on these vessels for the blood flowing through it. Beetroot juice, which is very high in nitrate content, research has shown that there can be a decrease in systolic, which is the first number, by as much as 10.4, and a reduction in diastolic by as much as 8.1 milligram after beetroot juice consumption. Effect become noticeable just 1 hour after consumption. How did nitrates benefit the heart? From the previous slide, able to reduce blood pressure, dilating the vessels. It's able to improve the blood vessel function by preventing damage and plaque formation on the arteries. It's able to improve the platelets, or the little vessels of, the little molecules that float around in our system that can contribute to the formation of plaques on the side of our vessels. It prevents the stickiness, or those platelets from sticking to themselves. It's able to reduce the harmful effects of ischemia. So from a heart attack, this is only done in mice and rats, and they've shown that basically an infusion of a nitrite during an ischemic event can significantly improve recovery and reduce the damage that occurred from that ischemic event to the heart, lungs, kidney, and liver. And they've also shown that it can enhance blood flow to the damaged areas following an ischemic event. Nitrates are also able to help reduce the lipids and triglycerides inside the bloodstream as well. So in conclusion, some nutrients here that are important for the overall health of your heart. Very important: vitamin E, magnesium, especially if you're looking at diets, niacin, fish oils, curcumin, adequate levels of nitric oxide. And then when we look at nutrients that are good for a damaged heart, or someone who had a heart attack or has heart failure, we want to look at Co-Q10, Hawthorn, Arjuna, and also can't forget regular exercise and a healthy diet. So here's some selected references. And also, in about a month's time, on March 8th, if you're enjoying the webinar series and you want to check out the next webinar series in March, it'll be on seasonal allergies, and it'll be hosted by myself as well. We're going to look at some natural ways that actually preventing and treating seasonal allergies. Thank you very much, and if you have any questions, we'll be here to answer some questions for a little bit longer, but also you can reach at tech@aor.ca. Thank you.